If you look at this X-ray, there's an abnormality in the right lung. It's a very well defined nodule that we're seeing in the right lung. I'll just show it here. So you can see that the margins of the nodule are very well defined and smooth. It looks almost like round, like a ball. And these type of lesions, nodules, are typically benign, but we will need to confirm that with a CT or some other test. It would help perhaps to look at the lateral as well. So we can see the lateral X-ray there. I'll just bring the lateral in. So this is the nodule on the lateral picture. Again, it's well defined and rounded. You can see it's in the middle of the lung. It's not posterior near the spine or at the back. So it's quite central. That's the mass there. So a CT would help, definitely. So I'll just show the CT now. So we'll look at the CT. You can see the nodule with little locules of fat inside them. You can see the fat locules there, and that's typical of what we call a hamartoma. So these little fat lobules. Sometimes you could get popcorn calcification in these lesions as well, and you could follow these up with a PET scan just to make sure they're not malignant, or biopsy, but normally we'll leave these well alone because this appearance is fairly typical. If they grow over 5 centimeters, then you may want to investigate further. Now, in this particular case, this wasn't followed up, and patient represented 5 years later with another mass. So this time we can see that there's another lesion. This is the original hamartoma, but now we see another larger mass which is more ill-defined with speculated margins, and that's of some concern, obviously. So we have 2 masses. So we show the CT scan now. So that's the hamartoma. And that's the second mass. So you can see there's a difference. The second mass is ill-defined with some areas of necrosis, quite aggressive looking with sharp margins, and this is typical of a bronchogenic neoplasm. So sometimes masses can coexist. So we have the diagnosis there is hamartoma, whereas the second lesion, it's bronchogenic carcinoma.